Hi, my name is April Hawley. I am a nurse in the Surgical Intensive Care Unit at Magnolia Regional Health Center. I specialize in cardiothoracic surgery and trauma. I'm also a nurse practitioner student at Union University, and today I want to talk to you about heart murmurs. When a patient comes into your office and they sit down and you listen to their chest and you hear a murmur, are you able to decide which valve is involved and what are the complications of that murmur for that valve? So we're going to get started today, and I'm going to help you answer those questions. So first off, we're going to go with some learning objectives. I want to be able to demonstrate the competency of ANA standard number 1 by you being able to locate the valves during a physical assessment. I want you to have an enhanced understanding of the pathophysiology behind the 4 heart sounds, what causes them. I want you to be able to successfully distinguish between systolic and diastolic murmurs, and integrate ANA standard number 8 by using the knowledge that you've gained to diagnose the cause of the murmur. So let's get started. The first thing that you have to be able to do in order to diagnose a murmur is know which valve is involved, and you have to be able to know where you're at on the chest and be able to distinguish which valve you're listening to. The best way to do this is to place your stethoscope downstream from the valve. That means that the blood is going to be rushing towards your stethoscope. So let's talk about each of these valves individually. The mitral valve is an oblique valve that sits in basically the 3rd intercostal space. In order to hear this valve, you want to go downstream, which means that you're going to place your stethoscope down around the 5th intercostal space, close to the PMI. This is putting your stethoscope into the left ventricle. So as you hear this valve, you're going to place your stethoscope here and hear the blood as it rushes into the left ventricle. The tricuspid valve is an oblique valve, and it actually sits right behind the sternum, but if you wanted to put it into a spot, it would be about the 4th intercostal space. So this valve sitting here, you want to put your stethoscope in the left or the right ventricle. So that's going to put you about the 5th intercostal space, but you're going to be on the left sternal border. So this is very close to the tricuspid valve, but you have to be able to distinguish that you are in the left atrium because you're sitting on the sternal border. The pulmonic valve is a horizontal valve, and it sits around the 2nd intercostal space. To hear this valve, you want to go above it. With the other 2 valves, we went below them, but the blood in this valve is going to be going up into the pulmonic artery. So you're going to want to be above it to hear this, and this is going to be at the 2nd intercostal space on the left sternal border. The aortic valve is another oblique valve. It also sits behind the sternum, and in order to hear it, we're going to have to go to the right side of the sternum, and we're going to go to the 2nd intercostal space on the right side of the sternum right here, because you're going to want to hear that blood as it rushes up and into the aorta. So this is where you're going to be placing, this is why you're placing your stethoscope in these areas on the chest, because this is what you're hearing. You're hearing the blood as it rushes through the valve to where it's going, whether it be the aorta, the pulmonic valves, or the ventricles. So let's talk about a murmur and what you're hearing. There are 2 types of murmurs that we're going to talk about today, but there are a multitude of murmurs. But these are the 2 that you're going to hear most commonly. The aorta is the valve that you're going to hear stenosis in most often because of the velocity of blood that is going through there and the fact that it gets so much pressure, it gets calcified very easily. Stenosis is when a valve doesn't open completely, and what you're hearing is like someone putting their finger over a water hose. You're hearing the velocity of that blood as it shoots through the valve. Whereas regurgitation, a valve is supposed to close, and it's supposed to keep the blood from going backwards, and that's its job. When it's not doing its job, it will flow like flail into the atrium or the ventricle and allow the blood to go back where it came from. So if it was supposed to be closing and not allowing blood back into the atrium, you're going to hear that blood rush back through that valve. That's what you're hearing during regurgitation or insufficiency. We call it either one. So now that you know which valve you're listening to and you know the two types of murmurs that you're going to hear the most often, let's talk about whether it's a systolic or a diastolic murmur. That's very important. You have to decide what your valve is supposed to be doing during that period of time. So during systole, you're going to be listening for the aortic and the pulmonic valve. They're supposed to be open during that time because they're pushing blood out into the lungs and the body. During systole, the mitral valve and the tricuspid valve are closed. They are supposed to be stopping that blood from being flushed back into the atriums due to the power of the ventricles contracting and forcing the blood out. During diastole, the mitral valve and the tricuspid valve are open. They are allowing blood to come from the atrium into the ventricles, and the pulmonic and the aortic valves are going to be closed to allow the ventricles to fill. So what you're going to look for is what you're hearing during those times. A systolic murmur is going to be between S1 and S2. It's a very It's a sound that you will hear between S1 and S2. It says lub, whoosh, dub. Lub, whoosh, dub. That's a systolic murmur. You're going to hear it between S1 and S2. A diastolic murmur is going to come at the end of S2. So you're going to hear lub, dub, whoosh, lub, dub, whoosh. So once you know which valve you're listening to, whether or not it is supposed to be open or closed, then you can decide if it is supposed to be insufficiency or if it's going to be stenosis. And you're going to hear this by deciding what your valve is supposed to be doing during that part of the cardiac cycle. Let's put this together. Patient comes into your office and sits down, and you hear this. Let's listen to it again. You can definitely tell that this is a lub, whoosh, dub. This is a systolic murmur. So it's in between S1 and S2. So you just happen to be listening here. You're in the second intercostal space on the right border of the sternum. You know that you are over the aortic valve. You know that during systole, the aortic valve is open. So if you're on the aortic valve, you're hearing a systolic murmur, and the valve is supposed to be open. This is stenosis. So let's look at another scenario. Your patient comes in, and you're listening here. Fifth intercostal space, midclavicular line, close to the PMI. You know that you're listening to the mitral valve. And this is what you hear. This is also a systolic murmur. Lub, whoosh, dub. Lub, whoosh, dub. You're hearing that in between the S1 and the S2. So you have decided which valve you're listening to, mitral valve. You've decided that it is a systolic murmur. And during systole, your valve is supposed to be closed. So as we listen to it again, you can definitely tell lub, whoosh, dub, lub, whoosh, dub. So if your valve is supposed to be closed during systole, this would be considered mitral regurg. So let's go back over everything that we've learned. Once you're able to isolate the valve, you know exactly where you're at on the chest and you know which valve that you're listening to, then you're going to be able to decide if it's a systolic or a diastolic murmur. Are you hearing lub, whoosh, dub, whoosh, dub, making it systolic? Are you hearing lub, dub, whoosh, making it diastolic? It's coming after S2. Then you need to decide what your valve is supposed to be doing right then during the cardiac cycle. Is it supposed to be open? If it is, it's stenosis. If you're hearing the valve and your valve is supposed to be open, it's stenosis. If your valve is supposed to be closed, this is regurgitation or what we call insufficiency. Your valve is not doing its job anymore. So you can decide then, stenosis, regurgitation. You've decided on your valve, you know it's a systolic or diastolic, your valve is supposed to be open or closed, and now it's stenosis or regurg. This can lead you in your diagnosis for your patient. Once you know what their diagnosis is, then you're going to be able to decide what this could be causing problems with their heart. Are they going to be more likely to have overload in their lungs or overload in their body? And if it is a loud blowing murmur, is this something that needs to be referred out to someone that can take care of it? So just a little bit of humor before we get out of here today. And then I thank you guys for sitting in on my presentation today. I hope you learned something that will help you in your practice.